All right, so we have another fairly short little presentation here on non-traumatic musculoskeletal disorders. This is something that you hear a lot about. It really doesn't, we don't see much emergencies as far as coming to non-traumatic musculoskeletal disorders, but it's something that definitely we should touch on and make sure that you have a bit of an understanding of some of these issues. So briefly, remember that we have the musculoskeletal system composed of the skeleton. They're technically two separate systems, but the skeleton itself, which is the rigid bony structure and provides the frame for our muscles to hang on. The bones are a living tissue composed of mostly collagen and calcium. And then we have muscles that are attaching to those, usually via tendons. And those tendons allow for the muscles to move the skeleton. Those muscles also produce heat and that maintain our body temperature, and they help us maintain our posture. Remember, tendons attach muscles to bones, and ligaments attach bones to bones. Here's an example of a joint. This is an actual cross-section of a hip joint in a human. You see the femoral head there, which is the large rounded structure, and then the little socket that it goes into is referred to as the acetabulum, and that is obviously displaced. It normally fits up in there very nicely, and there's some cartilage usually in there that helps it glide a little nicer. Joints, we have various different types of joints, whether they're immovable joints like the joints within our skull, the ones that are within the cranium itself. When we were babies, they were movable, but now that we are all grown, we have immovable or fibrous joints, or what are often referred to as sutures now. We have cartilaginous joints and we have synovial joints. So cartilaginous joints have a cartilage lining to it, whereas a synovial joint has a little bursa or a sac in there, and which has a little bit of fluid that I like to think of it kind of like as a breast implant. Everybody's seen what a breast implant looks like, but that's how I kind of envision synovial joints. They kind of have that little fluid-filled bag or sac in there that kind of is the shock absorber and helps things move a little nicer. So some of these non-traumatic disorders, arthritis, this is one that we deal with very frequently, yet we don't usually deal with the patient for this problem. Most of the patients that we deal with in EMS, of course, are elderly, and the elderly typically have osteoarthritis. And it's a chronic condition characterized by a breakdown of joint cartilage. So if you want to think about it as your shock absorbers have broken down in your car, so the ride gets very bumpy and it gets to be very uncomfortable, it's much the same way. Or if you you take the nice smooth lining out of something and you're left with a rough interior, it makes it so it just doesn't glide nicely. It commonly affects hands and wrists, elbows and shoulders, the spine, the hips, the knees, and the ankles. So obviously it's big in the extremities. It can't affect really anywhere where there's a joint though. So we have a couple types of osteoarthritis. Primary, which is typically associated with aging. Its cause is unknown. I think you can really think of it more like many people who, if you don't take care of your body, eventually it starts to break down. It's just like your car, the parts wear out. Secondary osteoarthritis, though, can be as a result of another disease or condition or even a treatment for it. And this is where basically some of the required elements within the body maybe are getting robbed. Or there's another disease process that zaps a certain process that maybe creates cartilage. So those are some potential causes of osteoarthritis. Osteoarthritis is different from rheumatoid arthritis. Rheumatoid is what is referred to as an autoimmune disorder. Basically, your body starts to attack itself. Your body starts to view certain tissues as foreign and decides to try to destroy it. And so these linings of these joints become inflamed, usually start out with just kind of general pain, warmth, stiffness, redness, swelling. But in later parts of the disease, people become very misaligned. The joint loses its shape, there's very limited joint movement, and oftentimes these joints get very, very knobby. So people who have giant knees or very giant knuckles, and you'll see people who can't even really straighten their fingers out all the way because they have these ginormous knuckles, and their fingers are probably crooked. They don't even go straight. They kind of hang down back behind the side of the hand a lot of times. So osteoarthritis is a disease of progressive bone loss. The bones become weak and brittle. They can become more easy to fracture. This is osteoporosis. I was going to say, why are we recovering this? Osteoporosis. This is the very common disease. Basically, the bones start to get zapped of all of their stored calcium and phosphorus, and its most common cause is fractures in women after menopause and older adults. Particularly postmenopausal women are at high risk for osteoporosis, and where their bones go from a nice rigid firm structure to basically a porous structure, hence osteoporosis. Fibromyalgia. This is a disorder characterized by general fatigue and widespread musculoskeletal pain and stiffness. Most often develops in early to middle adulthood. Tends to affect more women than men. Cause is unknown. This is generally a diagnosis of exclusion. When they get to a point in which the doctors are not really sure what's going on, there's not a definitive test for it. So in many cases, it's a diagnosis of exclusion where the doc says, I just don't know what else it possibly could be. You have all the signs that go along with it, so we're going to say you have fibromyalgia. Common assessment findings and symptoms are going to include musculoskeletal aches, pain, stiffness, soft tissue tenderness, depression and anxiety because it is painful, impaired concentration due to the pain, problems with short and long-term memory, headaches, bladder irritability and spasm, painful menstruation, general fatigue, sleep disturbance, and sensitivities to odors, lights, noises, touches, etc. A few things such as overuse syndromes, or we often call these carpal tunnel, is the most common one within this. Overuse syndromes are different conditions in which the body undergoes changes from repetitive motion. So just constantly the same thing all the time. So people who are always typing run that high risk of having carpal tunnel develop in their wrists. If they don't have the right engineering features to their keyboards and wrist supports and whatnot, they run that high risk. Common assessment findings and symptoms include numbness, decreased joint motion, swelling and burning, pain and aching, redness, weakness, tingling, clumsiness, and cracking of or popping of the joints. Carpal tunnel being the main, like I said, main offender of the repetitive motion injuries. The median nerve, or there's a nerve that runs right between the radius and the ulna through a little tunnel, actually, of cartilage and tissue. Starts to get built up, and as it slides through there, it becomes harder and harder for it to move. So the pain, burning, tingling, weakness, and numbness from its inflammation. You can get wrist tendonitis from certain types of activities, and this is appropriate because bowling tends to be a big one. Inflammation of one or more of the tendons around the wrist, and overuse can result in pain and tenderness, swelling in those areas. Tennis elbow, another one that's fairly common. This actually affects a lot of younger people. This affects the tendons that attach to the bone on the lateral part of the elbow, and the exact cause is unknown, but overuse results in a lot of pain and inability to move it. You can get golfer's elbow, similar to tennis elbow, but it involves the inside of the arm at the elbow joint as opposed to the outside. And the pain is usually triggered when gripping an object. Snapping hip syndrome or dancer's hip. It's an audible noise or snapping when that hip is moved from a flexion to an extension. Hip bursitis. Pain and inflammation over the outside of the upper thigh. Usually occurs in middle age and more common in men and women. Shin splints or medial tibial stress syndrome. This is pain over the front of the tibia. The actual cause of shin splints is when you go from not using certain muscles and parts, and then you all of a sudden put them to use again, you actually start to almost tear the outer layer of bone away. So it puts a lot of extra tension and pressure on that bone. Kneecap bursitis, swelling and pain on the top of the kneecap, really limits your motion. Achilles tendonitis, picture Achilles tendon, so it reduces your foot mobility. This is the largest and strongest tendon in the body, and it attaches muscles of the calf to the heel, and use it to walk, run, or jump. It's kind of important. And overuse typically results in pain over the back of the heel because it's starting to really pull. Pain or patient assessment, all of these things, none of them are going to be life-threatening. They're going to be more of a pain, more of a nagging chronic problem. So it's the standard assessment of do your initial assessment or your primary assessment, get your vital signs. Obviously this is not going to be a priority treatment and transport. Do a good secondary assessment, sample history, focused history, or focused physical exam, DCAT, BTLS if necessary. Feel the areas for any deformities or tenderness. Maybe it is actually a traumatic injury and they just didn't realize it. Feel and listen for crepitus. Check the CSM or the PMS, or whatever way you want to call it, but circulation, movement, or motor and sensation. A couple places you can also check the pulses. Check bilaterally, see if they're the same. Basically everything is going to be supportive here. Standard precautions. Treatment's going to be based on their signs or symptoms. Allow them to assume a position of comfort. That's the best thing you can do for them. And obviously your standard supportive cares. Splinting might actually help some of these issues, so you could consider that. Cold packs often are also helpful. And then transport for evaluation.